Congratulations on starting your Invisalign journey. I'm going to go over some use and care instructions for your aligners. These aligners are designed to work best when they're worn 20 to 22 hours a day, so you only want to take them out when you're eating or brushing your teeth. When you insert your aligners, make sure you don't bite them into place because they can crack if you have them in the wrong position. You always want to use your fingers to push them up over your teeth. To remove them, you want to start with the back, then move to the front and take them out gently. Once you take them out, you always want to store them in the case. I always tell people, when it's not in your face, it's in the case. Proper oral hygiene is very important. You don't want to get cavities while you're working on straightening your teeth. So you always want to make sure that you brush your teeth after every meal and you brush your aligners as well. When you're at home, it's easy to brush your teeth, but when you're out and about, you might not have access to a toothbrush. In that case, just rinse your mouth out with some water, and if you have any sugar-free gum, that can help as well. Let's go over some frequently asked questions. What should you do if you lose or break an aligner? I always tell people not to throw away their old aligners, because if you lose or break one, you can always move on to the next one. And if you don't have a next one to move on to, you can go back to the previous one. It's always better to have something in your mouth, some number of aligner versus nothing. Because if you have no aligners in your mouth, your teeth are gonna go all the way back to zero. Food restrictions. While you have your aligners in, you don't wanna eat or drink anything other than water. Once you take your aligners out, you can eat or drink anything you want. Just be careful of the very, very hard things like chewing on ice or something like that, as they can break your attachments. If you do end up breaking an attachment, it's not urgent. All we have to do is get you in for a new appointment to fix any of your broken attachments. Sometimes people wonder if there's going to be a lot of pain involved in this treatment. The aligners move your teeth very gently. It's a very gentle force that's put on your teeth, so the discomfort level is minimal. My advice would be to avoid any very hard foods in the first couple days of getting your aligners, as your teeth will be a bit sore. When you first start wearing these aligners, your tongue is not going to be used to having something in your mouth, so you might notice a little bit of a lisp. This will get better as you wear your aligners more and more. Congratulations again. As long as you follow these instructions, you'll be on your way to discovering your smile.